So I'm Caryl. I'm one of the heart failure specialist nurses in the community as well. So I'm going to be focusing on the expert patient, but from a heart failure perspective. Okay. So the aims of my presentation is to discuss the patient journey from diagnosis. That essentially means from novice to expert in the context of cardiomyopathy, but also heart failure. And also to provide a definition of cardiomyopathy, but Jane's already done that from that side, but we'll go through it. And to give an overview of the current treatment and guidance. Right. And the objective, so hopefully by the end of this presentation and when we've all answered the questions that we've got, that hopefully that you'll all have a little bit of an understanding of what being an expert patient actually is, and how to implement that in your day-to-day lives. So that's the thing. Slide, what is cardiomyopathy? I'm sure that you all know, especially if you're an expert patient. Cardiomyopathy means it is a disease of the muscle of the heart. So I won't go through that, and I won't go through the definition. Right. Heart failure. So this is why I went to get this. So in the context of heart failure, okay, we're just thinking heart failure is essentially the inability of the heart to fully pump. But if you think of it, in essence, the heart is a pump, but actually it's only the bottom. It's got 4 compartments, as we know, 4 chambers, but the top bit is actually the collecting chambers, and it's actually only the bottom bit that actually does the pumping. So in the context of heart failure, we are concerned about the right and left and the ventricles, basically, when you've got right side heart failure, but majority is when we think of heart failure and you've got that picture of that somebody who's really struggling, it's the left side of the heart. Okay, it's the inability of the heart to really fully keep up with its demands. Okay. Then expert patient. So I'm just going to give a second just to actually read this slide, because Jane, I'm going to go back. Jane spoke about, in the context of an expert patient and what that really, all the ethos behind it, but you're living with it in day-to-day practice. So when a patient is actually living with a chronic condition, the goals and expectations of the treatment are different. The person living with a chronic condition, i.e. cardiomyopathy and heart failure, you need to have that understanding that it is really lifelong, and to become a good expert patient, you need to have knowledge and be competent in it, because you are living with it day to day and like knowing your body. So that's the main take home of that slide. And I think the first line on this slide is really quite important. Healthy lives and promote well-being for all. I think that's the most important when you're living with a chronic condition, is to live as healthy life as you can. And you might go and see your doctor, clinician, your specialist nurse, and they'll be talking about lifestyle. I'd like to think that they'll be bringing lifestyle in to the consultation and the conversations. And it is important to have that awareness, because it does impact on your symptoms, especially from a heart failure perspective. It really does. So, if you don't, the heart, and I always tell my patients, like the heart, like any other muscle in the body, does need exercise to be strong as healthy as it can be. And it's doing that in an informed way. I don't recommend a cardiac rehab for a lot of my patients, because the ethos of cardiac rehab came from those patients who've had heart attacks and MIs, which is very different to the context of cardiomyopathy or even heart failure. So it was designed with that in mind, but to get those maybe that were living quite a stagnant lifestyle to be a bit more active. But a lot of our community are very active, but it's important to do it in the right manner and to be safe in doing it, and to have that, awareness of actually, if you are going to go out for a walk, how much can I push myself? So, it's about thinking of yourself in a holistic manner, and that's why promoting a well-being and healthy lifestyle, and also obviously the diets, eating a good varied, I always say, like a Mediterranean diet. I was in a support meeting the other week, and we were just talking in general about diets and different lifestyle, and some people were talking about going on the shakes and stuff like that. But when you've got a cardiac condition, you've really, especially heart failure, which is what my aim of my focus and my talk is when you're talking about like shakes and stuff like that, you're talking about volumes of fluid. So yes, they might lose a bit of weight, but in the context, their heart failure symptoms might go, they might exacerbate their heart failure symptoms because you're getting that volumes in. If you're talking about 2 shakes and a soup, then that's all of your quantity that you should be having. So it's about living that healthy lifestyle. So let's go back to the patient journey. And I know that Jane spoke about the 2022 survey, but I put this in from the 2019 survey because I really liked the impact of I really like the visual impact of the patient's journey from diagnosis. As you can see at the bottom, you've got diagnosis and new treatment, and that awareness and understanding. And when you're becoming an expert, when we talk about expert patient, we do think about from the beginning of the journey, going through to what Emma was saying about transitioning into the adult service. And I like this image because it is actually like a roller coaster. And when people talk, so you might have had a diagnosis of cardiomyopathy, then, you have your scans, you have your you have your echoes, you have your MRIs, and then you get diagnosis of heart failure. And then I see it a lot. I have people coming back to us saying, well, I've just had a diagnosis of heart failure now on top of my cardiomyopathy. Where do I go? Does this impact on my, on the trajectory of my care? What's the situation? And actually, it just shows that it is like a roller coaster. So you might be started on new medications. That's the first line treatment. And then there's other options to be had. So this is why getting the information and the support and getting it explained to you in a clear, non-jargon format will help you have that awareness and understanding, so that you're not being sent home from your appointment with all of these questions in your mind when you have that diagnosis. And this is why I do like this slide, and it's coping from an emotional side of it, and this was all taken from the cardiomyopathy survey, but it was a later one. It was an earlier one to what Jane had said. Okay. So when you have the diagnosis, you have that information, and you want to, take charge of your diagnosis and your care, then you have to know the right places to go to get that information. Our community is very good, and you've got a lot of peer support. You've obviously got us from a clinical standpoint. You've got your own cardiologist, you've got your own specialist nurse maybe, but also maybe you'd want to go and have that further information. And the European Society of Cardiology has a lot of information, and it's the most influential, I would say, especially from a heart failure perspective, I would say the most influential guidance and guidelines that are out there. And these are the ones that hold, that you can take back to your clinician and they will have that kudos, I would say. So, being an expert patient, have a look at these guidelines if you wanted, just to get that more information to actually say, am I getting the right standard of care? And what I would also go back to from the support line calls that I've been doing, and I don't know if Emma and Jane feels the same, but it's having that actually a lot of the patients out there, a lot of our people in our community, our service users, aren't being seen by a cardiologist that actually specializes in cardiomyopathy or even heart failure. They might be under a generalist cardiologist. So that's really, really important to have an awareness of those guidance. And I put this slide in because I think it's a bit clearer than the previous slide, in the context of when you do have a diagnosis of heart failure, there are, you've got heart failure with reduced ejection fraction, and that's an ejection fraction that's less than, I would say, 40%. So it's 40%. And, people, they focus and home in on the ejection fraction so much. And it's not until I've come into my post as a heart failure clinical nurse specialist that I've actually thought, well, actually, in the context of everything, ejection fraction, it gives a borderline idea, but it's the symptoms that need to be taken into context. It really, really is, because you might have somebody with a ejection fraction of 45% who are much more symptomatic maybe than somebody with an ejection fraction of 10%. Or, especially in our community with HCM, HFpEFs, so you might have a scan, you might have an MRI, and your ejection fraction is greater than 50, so you might have an ejection fraction of 55%, but you are very symptomatic, you're very short of breath, you are edematous. So that is in the context of things. So it's very important to take a holistic approach. And, as when you have an echo, especially, I always think that MRI is a gold standard when it comes to having that information. So if you've had an echo and then an MRI the following week, and your ejection fraction is a little bit higher on the echo than the MRI, you should always focus on the information from the MRI. That's the first thing. But also in the context of echo, you might have a sonographer that maybe measures a little bit different. So it's, as humans, there's, humans do make a little bit of errors, don't they? So in the context of the technician might not have that much a difference of the ejection fraction might be different if somebody else was looking at it. So that's what I'm trying to say. It's that give and take in the context of that. So medications is first line treatment. So it's really, really important as an expert patient to know the right medication that you need to be on. So again, going back to the ejection fraction, if you have got an ejection fraction of 40% or less, you should be on the 4 pillars of pharmacological treatment. You should be on Entresto, which is an ARNI. That is the aim, that is the gold line standard. You should be on Entresto, and we should be appetite titrating to the maximum dose that is feasible for you in the context of your blood pressure and the bloods, really. You should be on a beta blocker, ideally. Obviously, unless there's any contraindications, this is it. But, the aim is to get on these. They should be on an MRI, ideally spironolactone. But if you've had an MI, or if there's an MI in the history of ischemic heart disease, then eplerenone is the choice of MRA rather than spironolactone. So that's an important awareness as well. And then SGLT2 inhibitors, which is the dapagliflozin, I should say, or however people say it. But that's a game changer in the context of heart failure, because actually everybody with a diagnosis of heart failure should be on an SGLT2 inhibitor, which is the only medication actually that is prescribed, or NICE has recommended. NICE has recommended for in the context of all heart failures. So with an ejection fraction of 55%, it is recommended that should be on SGLT2 inhibitors. Currently, in the context of licensing, it's dapagliflozin for ejection fraction of less than 30%, but or 40%, I should say, sorry. And an ejection fraction of higher than 40% should be empagliflozin. So still. So any questions with regards to that? You can actually put in the chat, because I think that's an important slide. There's a lot to take, but yeah, it's in, yeah. So please put a question in the chat with regards to that. In the context of heart failure, I think self-care strategies and having an awareness of the red flags is really important. You really do need to take into account every little things. If you are finding yourself getting a little bit short of breath, you know, I always encourage everybody to keep like a symptom diary, because it's all, even if it's a 99p booklet, you know, if you want to be an expert patient, then you need to know, you need to be an expert on yourself, don't you? So in the context of write down all your symptoms, because days roll into each other, and you want to speak to a healthcare professional and they'd be like, well, how long has this been going on? And in your head you might think, oh, it's not that long, but actually it has been a few weeks, or it's even been months. So, and actually you think, oh, it's happening daily, but it could be every other day, or once a month, you know, or once a week. I mean, so it is in the context of getting if you do get a symptom checker, it's really, really important, I think, to have an awareness of your own body and your own symptoms. Everybody should have a traffic light scale. I don't know, I'd like to think that everybody with a diagnosis of heart failure would have a copy of the traffic light scale. It's you don't even have to think about it. It's just there in front of you, and you can get to know, and actually, you know, if somebody might tell you, or how are you feeling today? You know, it's having that understanding, actually, I'm not great today because I'm not feeling great to myself. I've put on this much weight. I'm really getting short of breath. And actually, what should I do? So this is a quick checker that actually is in front of you. And it might be a case of increasing your diuretics, you know, taking an extra diuretic at midday. So that is really, I think, I would say, important. That's really, really important. Also, really important, because in the context of heart failure, medication is important in the context of it helps your symptoms, it helps you feel better, it keeps you out of hospital, it saves those hospital admissions. So it really is. So you want to be on your medications and on the the highest dose of the medication that actually you can tolerate in the context of how you feel and how your blood pressure is doing, how your heart rate is doing, how your blood's doing. But if you do have to stop them, then it's important that you do. But, you know, if you are feeling unwell, generally unwell, so if you're vomiting or having diarrhea and vomiting, or if you're not eating, it's really important actually to stop some of the medications, especially the SGLT2 inhibitors. So, you know, your dapagliflozin and empagliflozin, because actually those medications were initially prescribed for type 2 diabetic patients. So it helps get rid of all the sugar in your body, but also if you keep taking them and you're not eating a proper diet or not keeping yourself well hydrated, then it could lead to problems, especially if you are diabetic. You could land in a bit of trouble. So stopping your medication, or even if you're finding yourself generally unwell and having to go into hospital, and you've seen a healthcare professional and they've said, okay, we need to hold these medications for a bit, have an awareness that actually trying to get back on that medication as soon as is feasible and that is as safe for you, because people tend to keep off the medication and then it's a vicious circle because you're not on the medication and you become a little bit more unwell, so yeah, that's important. And education is key. And I know I had the slide about the ESC guidelines. I think that, having an awareness of those guidelines, but getting your information from the correct place. Like Jane had said, come to us as clinician, we've on the support line, contact your own heart failure specialist nurse if you've got one, contact your cardiologist, or go on to reputable sites, go on to our website, or go on to the NHS guidelines. Don't go down a Robert Warren hole and be Dr. Google, because that's not where you get the correct information and education is key. And this is going back to the initial slide that I had from the survey. This is from diagnosis to, palliative care, in essence, all the way through from transitioning. So it's about getting, even if there's a new diagnosis or something new, or you've been told something and you don't quite get it, always ask, and the right people, and get information from the right place. That's the key take home from that slide. Current guidance, NICE. We've mentioned NICE. I think the ESC, a huge, and get the most up to date, because one thing I will say, especially in the context of heart failure, I know that research and everything is really important, but actually when I went to the ESC conference last year, they said actually, from the context of heart failure, we don't need more audit or research currently, because we just need to implement in practice what we currently have. So knowing what the current up-to-date research and guidance is really important. And additional online resources. I think we've mentioned our national conference that we have every year. All of that information is going to be on our YouTube sites. Which we're trying to update our website. I know that is something that we're doing. So please don't give up if you can't find what you want. You can contact us and we could even email it to you or signpost you to the correct place. Because if you go on to it and can't find it the first time, just don't think that it's not there. We can signpost you to the correct place. So that's really, really important.